Hello. My name is Jones, and today we are going to look at a condition in mental health known as paraphilias. Paraphilias are complex psychiatric disorders that are manifested as unusual sexual behavior. Diagnostic and Statistical Manual of Mental Disorders Text Revision, that is the DSM-4 TR text revision, defines it as a recurrent, intensely sexually arousing fantasies, sexual urges, or behavior generally involving inanimate objects, that is non-human objects, suffering or humiliation of oneself or partner, children, or non-consenting person. So this is the definition from the DSM-4 TR or text revision. Okay, the recurrent, intensely sexually arousing fantasies, sexual urges, or behavior generally involving inanimate objects, suffering or humiliation of oneself or partner, children, or non-consenting person. Diagnosis. The criteria for diagnosing these disorders are: we have criterion A and criterion B. In criterion A, the unusual sexual behavior should occur over a period of 6 months. So if the unusual sexual behavior, that falls under paraphilias, is observed for over a period of 6 months, then for this person it will be considered a mental health disorder. Then there's a criterion B. The sexual behavior caused a clinical significant distress or impairment in social, occupation, or other important areas of function. So criterion B differs for some disorders, that is for pedophilia, voyeurism, exhibitionism, and flirturism. The diagnosis here is formulated if acting out on these ages or if the age itself caused a significant distress or interpersonal difficulties. Okay, so these differ from the criterion B. Okay, so criterion B differs for sadism. A diagnosis here is made if these ages are done to a non-consenting person. Criterion B differs for some disorders like other paraphilias, that is a diagnosis created when the sexual behavior, ages, or fantasies caused a clinically significant distress or impairment in social, occupation, or other important areas of functioning. So if one does this and it's affecting their important areas of function, we will look at it as mental disorder, and this person cannot necessarily stop. So in criterion B, we also differ for sadism. A diagnosis here is made if these ages are done to a non-consenting person, and also it differs for pedophilia, voyeurism, exhibitionism, and flirturism. So some 8 specific disorders of paraphilia that we can discuss here include exhibitionism and also fetishism, flirturism, pedophilia, sexual masochism, sexual sadism, transvestic fetishism, and voyeurism. Okay, so exhibitionism, or from the word exhibit, exhibitionism, this is the repeated age or behavior of exposing one's genitals to strangers or masturbating in public areas. So this is a type of paraphilia which is known as exhibitionism. Then there is fetishism, which is also an exhibitionism kind of paraphilia. Okay, so fetishism is characterized by use of inanimate objects to achieve orgasm or gain sexual excitement. Common fetishes are women's undergarments or shoes and other apparels. An individual with this disorder masturbates while holding or rubbing the private parts to these apparels. Then frottalism. This is a persistent age of touching or rubbing against a non-consenting person in a place where a person with this disorder can make a quick escape. Okay, that is in crowded places or public transportation, shopping mall, or crowded sidewalk. So the person rubs his hands against a victim's breast or genitalia, or he can rub his genitals against the victim's thigh or buttock. So frottalism, okay, persistent age of touching or rubbing against a non-consenting person, okay, in those uncomfortable areas, okay, sexually uncomfortable areas. Then pedophilia, that is a sexual activity that is done with a child 13 years or younger, and is a characteristic. So when one wants to have sex with a child less than 13 years or younger, then this becomes characteristics of pedophilia. So the pedophile should be at least 16 years old or at least 5 years older than the victim. Then the other paraphilia that we can talk about is sexual masochism. Okay, sexual masochism is the intense and persistent sexual urge involving acts of suffering, that is, beaten or bound, okay, and being humiliated. So, the intense and persistent sexual urge involving acts of suffering and being humiliated is known as sexual masochism. Then there is also sexual sadism. Okay, this is a sexual urge involving acts in which the pain, suffering, or humiliation of a partner is arousing that person. Okay, when you inflict the pain in the other, okay, you inflict pain on the other, or suffering, or humiliation, then you feel better, or you feel aroused as a person. Then you have this mental health disorder of sexual sadism. Then there is transvestic fetishism. Okay, this one is a sexual fantasy, age, and behavior involving cross-dressing by a heterosexual male. So transvestic fetishism, a sexual fantasy or age of behavior involving cross-dressing. So here you can remember transvest, okay, that this cross-dressing, which recently has become somehow a bit common. Then voyeurism is a sexual arousal by observing and suspecting person who is naked in the process of undressing or engaging in sexual activity. So voyeurism, sexual arousal by observing and suspecting person who is naked. Okay, so today we have looked at paraphilias, okay, which are complex psychiatric disorders that are manifested as unusual sexual behaviors. Okay, DSM-4 text revision defines paraphilias as a recurrence intensely sexual arousal fantasies, sexual urges, or behavior that generally involves inanimate objects, suffering or humiliation of oneself or partner, children, or non-consenting person. Okay, then the diagnosis criteria, there's criteria A and criteria B. In criteria A, there is unusual sexual behavior that occur over a period of 6 months. Okay, then criterion B, the sexual behavior causes a clinically significant distress or impairment. Okay, so criterion B, though it differs for some disorders like pedophilia, voyeurism, and others. So that has been our lesson on paraphilias. Thank you and keep studying.